Welcome to the Irish Occupational Therapy podcast, hosted by me, Jen Trechek.
And me, Irene Rutledge.
This podcast is dedicated to exploring the world of occupational therapy, sharing the latest research and techniques and providing insights into the many ways that occupational therapy can help people of all ages live more fulfilling and meaningful lives.
Whether you are a practicing occupational therapist, a student of occupational therapy, or simply curious about this fascinating field, this podcast is for you. We'll be interviewing experts in the field, sharing stories from the front lines of occupational therapy practice, and providing tips and advice for anyone looking to get the most out of their therapy.
So sit back, relax, and join us on this exciting journey into the world of occupational therapy in Ireland. So today on the Irish Occupational Therapy podcast, we're joined by Dr Áine O Dea. I'm really lucky. Áine is my clinical supervisor and has been an immense mentor to me. And she does a lot of supervision, business support, mentoring, coaching. But we're talking to her today about an area of expertise. I think it's fair to say Áine is probably one of the foremost experts in Ireland on the area of dyspraxia and DCD. So Áine, we were hoping to talk to you a little bit about that side of your work and your research, if that's okay. So just tell us a little bit about yourself and, you know, how your interest in dyspraxia came about.
Oh, thank you, Jen. Thank you for such a beautiful introduction. I'm blushing. How did it come about? Back in 2009, I was in a very fortunate position where I was asked, would I take a secondment to the HSE from the public sector job that I was working in at the time for St. Gabriel Centre, to help to establish the primary care strand of the paediatric piece of the primary care strand. And I thought, yeah, this sounds really interesting. I'd love to. And I did. And at the time in Limerick, there hadn't been a formal primary care service for children. So my role was to set that up and audit it and put in all the processes and support staff in primary care to develop the skills and competencies for seeing children and young people. As part of that job, there was a historic waiting list which we worked through, and it was quite astounding to see how many children were originally referred, maybe at the age of 7 or 8, that were presenting with motor coordination difficulties. But obviously, we were now seeing them some of them were definitely 12, 13, right up to 16. And back at that stage, I was like, what am I supposed to do with 16-year-olds? Because in 2008, 2009, there wasn't as much research out there around treating, that adolescent cohort for neurodevelopmental, and even where they didn't have a diagnosis. So it prompted me to do my master's, because I started out with a bit of going, well, what am I supposed to do, and feeling highly incompetent. And I started my master's and started looking at this. And then when I started to look at the evidence out there, it wasn't there. So I completed my master's thesis off of an Irish health data set, the National Physical and Sensory Disability Database. And that database is actually quite unique internationally, because we don't always think of ourselves as leaders in the health data space, but actually we are with regard to this. So we collect health data that not only looks at the diagnosis, but also regard to actually what are the activity limitations and participation restrictions. And one of the main forms they use, it's called the MAP, Measure of Activity and Participation. So as a nation, we're right leaders up there on looking at activity and participation. And the findings of that, so I looked at the age ranges of young people 16 to 19 years old. So they would all have had a diagnosis, and I wanted to see, well, what's the profile of young people with DCD, dyspraxia, and what do they want? What are they telling us that they need? So my master's opened up more questions than answers, because what I found out was actually the services aren't there for 16 to 19-year-olds. They're looking for them, and it's not around the motor coordination difficulties. it's all around life areas. It's all around planning, organization. Huge pieces came up around those kind of like on when you looked at the performance difficulties. So it was all around that and the well-being side of like the impact of anxiety and social isolation. So after finishing my master's, I went on maternity leave and then came back from maternity leave and was like, do you know what? I think I'd like to do a PhD in this area. Because I suppose at that time within primary care, we were doing a lot of occupation-based groups in the community. We were doing a cooking group, which was life skills, and we actually went to the supermarket. But we were doing all of this, and yet it's the theory that we know is accurate, but it wasn't there in the evidence to back it up. So I was like, well, without the evidence, we'll never be able to say that this is the best approach to treat these young people. So I decided at that point, and then that was when over like from 2012 to 2015, that I really started to look at becoming more research active and being involved in more projects and actually applying for research grants as well. So that was really what stimulated my interest in the area. So, yeah.
Yeah, Áine, because most people would think of motor coordination being the primary area. So that's really interesting that there's so much more to DCD. Can we go back to the terminology, Áine? So some people use the terminology dyspraxia, DCD is another title. Can you talk to us about the difference and are they the same thing?
Absolutely. So dyspraxia is what we would call the layperson's term, okay? Or actually, really and truly, it's a term that's known in the community. It originates from a Greek word of praxis being that piece of like movement, motor planning, okay? And dys meaning that there's a dysfunction there. So it means a dysfunction with motor planning and problem solving, okay? That's it very briefly. And that's, so for years, there's been loads of different terms used, like back in prior to dyspraxia, you terms like clumsy childhood syndrome. So like some of them were quite awful connotations. But dyspraxia was the one that was most common up until 2005. The international research started to change in around 1997, saying that, hang on a minute here, it doesn't capture this profile. It's not just about dysfunction within motor coordination. There's actually a huge umbrella of different features of like what we were talking about there, of the executive functioning. So, you know, planning, problem solving, organizational skills, time management, anxiety, well-being. And that wasn't captured by just looking at this motor piece. So back in 97, a group of Canadian researchers led by Cheryl Masuna and Helena Palacevic, they then came up with the term developmental coordination disorder, which is a much broader umbrella term that actually these are developmental coordination challenges that arise the developmental period, so in that early period of childhood. And that's where it came from. They also advocated for that term to like try and better capture, to be able to describe the different features in clinical practice, but also in research. And then that was in 97. Then in 2005, you had the Leeds consensus. And that was where maybe more of the European-based research in the UK, led with, people might be familiar with the work of David Sugden. He's one of the developers of the original movement ABC with Sheila Henderson. And they agreed to adopt the term DCD. But we see really clearly in the research, and research as clearly as published as last year, the people with the lived experience of this, they prefer the term dyspraxia. So I think we have to be really respectful that DCD might be a clinical diagnostic terminology, but dyspraxic individuals are telling us they prefer the term dyspraxia because that term developmental doesn't capture the pieces for a young adult or an older adult.
And disorder is quite a negative connotation. You know, I know it's used a lot, but it looks at what's missing rather than strength.
Absolutely, absolutely. And that's a huge piece of it as well, Jen. So I think we do need greater communication and conversation around this. It will evolve again. When it will, I don't know, but or maybe we use both terms. I'm not sure what the answer is, but I think it needs to come from the dyspraxic community.
Just when we talk about strengths there, Áine, could we think about and discuss some of the strengths someone with dyspraxia has?
Aideen, that is an amazing point. So, as part of my PhD, one of the largest studies that I was involved in was a study called Examining the Lived Experience of Children and Young People with DCD, dyspraxic individuals. So that paper, that study, when I started it, I had no idea of what the findings were going to come out of it. So I looked at a cohort of children and young people describing their lived experience. And that paper showed all of the strengths. There's very little in the research that is really showing, well, what are the strengths? It's all about deficits. And what the findings of that study showed us, and it's a large enough study because it's what we call a meta-analysis. So it's where we've taken like multiple studies and we've pooled all the data. It's a really good way of like broadening our findings so that we have a much bigger representation across the population. So many of the strengths that the findings of that paper showed were strengths around children's attitude of that just can do. So often in psychological terms, we'll talk about it as a growth mindset, but children had the awareness and understanding to say, well, I can just do it my way, or I can just try it. So that piece. One of the other clear strengths is their capacity, their awareness and understanding of their own abilities. So where the environment matched that, children flourished. Where the teacher was really understanding and where their parents were really understanding, they were aware of what they could do, and people around them supported them to help them to practice, to try more, to adapt. Where children weren't exposed to that environment of like supportive and helping them to practice, that was where we saw maybe some of the negative consequences. So children described parental frustration, teacher frustration, bullying by victimization. So people saying mean things to them, marginalizing, leaving them out. And whether we like it or not, children said that adults were often very mean, both parents and teachers and wider ones in the community. So we do need to be conscious of that teasing and joking. It is not fun to young people. Other strengths were that they found out their own ways of doing things, okay? So when it came to organizational skills, they developed their own strategies of how to ask for help, how to align with other peers with similar interests. We need to be talking to the young people and ask them, what works for you? How do you do it? What do you like to do? Rather than coming in with our preconceived goals and notions that
checklist. Yeah, you should be doing this at this stage. Yeah.
Yes, and you need to practice these performance skills, because clearly if you don't learn to throw and catch a ball, you will, like, what's going to happen? That actually, that's not the be all and end all.
People are so adaptable, aren't they? And children in particular are very adaptable. But one of the things that I'm just wondering, so I work with adults as well as young people, and I'm finding more and more adults getting diagnosed with things like ADHD and with autism later in life, and things that you would say are neurodevelopmental conditions. And I guess DCD, dyspraxia, is neurodevelopmental. Is it always picked up in childhood, or are you finding, can it be diagnosed in adults? Does it present with adults?
Yes, absolutely. And the research is so clear on this, and exactly like what you're saying there in clinical practice. So many children with DCD will be missed in childhood, because, you know, it's as if, oh, they're just clumsy, they're just a bit slower than their peers, because it's quite hidden. So, and it's very individual as the presentation. So for many children, it will be. One of the bits that really astounds me, and I know this is quite controversial, but the research always like uses the statistic of the ratio of boys to girls, that, you know, it's much higher in boys than girls. But when you look at some of the research, so some of the research looking at particularly for premature babies, and it's predominantly Swedish population-based research, there's no difference between the ratio of boys to girls when they're looking at that cohort. So for me, and I've seen this so many times in clinical practice, girls are often overlooked because they don't present, maybe motor skills, gross motor skills. You can kind of get away without it. All right, she's just not that into.
She's not very sporty. She's not great at football. It's fine. She doesn't need that skill.
Exactly. And then some girls will really practice and work hard on the, fine motor handwriting bit. But you'll really see it in teenage years around actually all the challenges around the executive functioning, planning, organization, anxiety, managing friendships. So you see much more around the kind of like the cognitive social elements. And for me, I feel like we're doing children and young people a huge disservice, because that paper on the lived experience, that was one of the things that found out that a huge strength is awareness and understanding. That if we can do anything, let the young person understand themselves, so that they know why things are tricky, so that they know what strategies help them and where to get help and how to tweak things. So I think it's phenomenal that we have more adults now going, gosh, that was me in childhood. And we can do the assessment. There's tools out there that we can use. Amanda Kirby has developed the adult checklist for DCD. And okay, it's not a standardized one, but it's there, and it's, it very clearly outlines across the 3 areas: current challenges as an adult, but also looking back on what were the challenges there in the developmental years. Obviously, you still have to rule out that, there's criterion D, which is there's no other medical explanation. So as an adult looking back going, well, did I have a bad fall as a child? Was there any risk of, head injury or anything like that? But most of these adults are, they're living life, they're getting on, they're doing things. It doesn't mean that things are easy and then navigating. So we can really look at the diagnosis for adults and support adults to understand why. And one of the things I've seen in clinical practice is often adults will present for a referral when maybe actually they're out on sick leave from work because actually it's been they're burnt out and they haven't coped with it. And we know from the research that, looking at children, that when you look at the neural mechanisms, so the brain scans, they work twice as hard as the person without dyspraxia DCD. So in some of the pieces we can see that there's way more brain areas firing when they're engaged in like fine motor activity. So what that's telling us is that actually children, adolescents, adults, they're going to experience cognitive fatigue. And if you experience cognitive fatigue and you don't manage it, it'll lead to anxiety over time. So for me, I'm a real advocate of support adults to get a diagnosis if that's what they want, so that they have a better awareness and understanding of themselves.
It's such like I've gone in and out of that debate in my head so many times around, should we label people? Do we need all of these diagnostic labels? But on the other hand, I've seen the power of actually somebody knowing it's not just me. It's not just that I can't cope or that I'm not good enough. It's actually the way my brain works, and it's working against me, and it can be such a relief. So it's something that I go back and forward on. But I think if somebody finds that label helpful, absolutely they should.
All about identity and like what you're saying there, Áine, about self-awareness and insight into how you function as a person. And Áine, what about then any practical tips if maybe there are adults listening who feel that they may have DCD or dyspraxia? How would they go about investigating that, or what sort of tips would be helpful for them in their workplace?
Aideen, one of the things, like what Jen said there, whether they want a diagnosis or not, that's up to them. But maybe even a consultation with an occupational therapist, because yes, I can give generic tips, but the research is really clear. It needs to be individualized to the person, because DCD presents very differently. My life is going to be different to your life. So they need to be able to maybe sit down and have a look at like their day, their week, their month. What are the really important things to them? Where do things get tricky? What is it like? Is it that I'm constantly late for work and I have a boss who's constantly giving out to me? So to be able to try and hone in on what's working well, where do I want things to improve. And be that for a child or an adult, parents can do this with their kids and sit down and talk to their kids. Their kids know where where people are giving out to them. They know where they're doing brilliantly, and try and identify the priorities for the child or the adult, and then merely take it kind of like analyze it, try and be the outside observer and go, where are the biggest problems? So this is where an OT can be so helpful, to have just even a one-off consult, so that you can look at, and OTs are trained to break down and analyze tasks and environment. So see, where is it getting tricky? What kind of supports do I need? Do I need what we call cognitive strategies? So like using timers, reminders, planning, or something that will cue me to do something? Or do I need to actually develop a skill? Or is it about, awareness and acceptance that, do you know what? No, I'm never going to be good at peeling the spuds. So actually, let's just buy pre-peeled potatoes. So my biggest tip to people would be, if you can identify what is causing a bit of like angst in your life and what's working well, compare the two and try and use the strategies for where things are working well and apply them to the other areas. That will help. I don't know if that's too vague for people, but that for me is one of the biggest things. I would also say that piece around social environment. So trying to change our attitudes. And there's a lot of talk about in the media, and people go, well, what am I supposed to do? But actually, if as an adult and I work with you and I understand that, you know what, Aidan, you're often going to find it tricky to be on time for meetings. You might arrive with the wrong folder, and you might that I can actually have empathy and go, that's genuinely difficult for Aidan. But that I can also then ask you and say, Aidan, is there anything I can help with? Is there anything that you need from me to prep for this meeting, to do this? So that we don't blame and victimize people or marginalize them. So leave them out, exclude them. So knowledge is absolute power. And I think that goes the whole way up from children to secondary school to adults.
That's such an important one. I find with adults kind of saying, what adjustments can I ask for in the workplace? And I think one of the biggest adjustments is just that understanding that I'm not doing this deliberately, and a little bit of compassion and support rather than getting annoyed with somebody. I think that is huge. And in terms of that kind of awareness and awareness raising and kind of people understanding a little bit more, do you offer support or training to schools or to parents or to workplaces around this, Áine?
Yeah, I'm always open to doing training, because for me, I love that piece around sharing the knowledge and the information. So definitely training. I don't do as much anymore in clinical practice, but I do a little bit every now and again. I have to say, I do love the piece around not the assessment, the diagnosis for adults anymore, but I love that coaching piece for adults, so that it's just because the changes that people can make in their lives. So yeah, training is probably a big piece that I do these days, Jen. I do a lot of training for health professionals, so OTs, physios, psychologists, speech therapists, teachers, around everything from best practice and intervention to looking at what does it mean in our work environment.
What about CPD, Áine, for any advice for occupational therapists or related professionals who work in this area of DCD? Are there any particular postgraduate training courses or anything that you would advise?
I would say, if they can pull down, and even as CPD, read a few research articles. I mean, I know this sounds really I don't mean it to sound egotistical, but that paper that I was part of, that research study around looking at the lived experience, that is one of the first in the literature that's looking at what is this population telling us. So that's open access, pull it down, they can read it. There's also a policy brief that goes with that. So it's a 2-page infographic that will give you all the research findings. So I'd say it's the first part of CPD that is free. Is just read those papers. There's a new book out by Hannah Daly. If you can have a read of it, it's a brilliant book, and it's also available on Audible. Then I suppose the second bit is that, Aidan, I run a course I've ran it for AOTI and for Dyspraxia Ireland on best practice assessment and intervention. And that one is a really practical CPD for professions, because it looks at, there's a lot of myths and misunderstanding around the assessment. People get very bogged down at times of, is it below the 5th percentile on the movement ABC? So that course really clarifies all of the information we need to know around looking at the assessment, and not just the physical motor coordination, but looking at the psychosocial impacts and mental health much earlier. And it looks at best practice intervention.
We'll include links to these in our show notes, and especially the paper there that you spoke about as well. Áine, can you share with us any myths around dyspraxia that's out in the community there, and tell us like an alternative hypothesis to them?
One of the biggest myths that I often come across, now there's multiple, but is the piece of that, well, the child is brilliant at soccer or swimming, but they can't be dyspraxic because they've got these brilliant motor skills. And that's absolutely inaccurate. So a child can be brilliant at soccer or their specific interest, because what's happened is they've really practiced and honed the motor skills for that activity, but it doesn't translate or generalize out to other activities. Okay, so one of the biggest ones that I worked with, somebody who once actually was a high level kayaker, and I mean nationally and internationally, but yet on a pragmatic everyday level had huge challenges with just really simple functional activities. So it's a myth to think that people, because they're really good at one specific or a couple of motor activities, that they don't have DCD. And this is why it's really important that we have professional awareness around this, because we need to be really looking at criterion B. What is the impact on activities of daily living? So across it, not just honing in on criterion A. Are their motor skills in line with their peers? Their motor skills might be in line with their peers for one or two activities, but what's the impact in the wider sense across their activities of daily living?
So back to individualization and taking the child as you see them and as they are.
Yeah, and looking broadly. Yes, I'm great at soccer, but actually the teacher says that I constantly bump into things in the classroom. I knock it over. My parents say they never take me shopping because actually I'm always bumping off the shelves, or I spill things as I walk across the kitchen floor, or my school bag is an absolute mess, or I'm forever dropping toothpaste on my shirt in the morning. We need to look really broadly at the motor proficiency skills, not just in, and that's why we have to be really careful when we're interpreting the information from the standardized motor assessment. So like the movement ABC or the Brunics.
That's really helpful for parents as well, because I think we can get caught in the trap of, well, you're good at this, so if you put the same effort into this, then you'll be fine, and nearly thinking it's a laziness thing, or it's the child not wanting to do it, and that's not the case.
It's not, because think about, for any of us, if we're really interested in it, the dopamine in the brain fires, there's a reward there because we like it. So we learn the skill much quicker and we get way more reward from it. The dopamine and the interest won't fire for everyday things like tidying my bedroom, managing my everyday routines. So it's really difficult. And there's a natural tendency there of where my brain works differently. So it's not easy for me to develop and learn those skills. And that's why we want people to have those special interests. That actually, that's what keeps us well, because that's where I make friends. That's where it's stress relief. That is where I have fun. And they're the bits that enhance our mental health and our physical health.
That psychoeducation for everybody involved then is so important.
Absolutely.
Thank you, Áine.
Yeah, thank you.
Áine, you were in Ireland, you were the first OT to be awarded the Sphere Scholarship, which is quite a prestigious scholarship for research. Just in terms of undertaking the PhD, which, as I've said before, I'm in awe of anybody who does this. What was it like? Would you encourage OTs to undertake doctoral research?
Oh, absolutely. I mean, Jen, you know me, like there is a little bit of a nerd in me, but I loved it. I really loved the PhD. The Sphere program was extremely supportive. Obviously, it's a very small, like there's only about 6 to 8 places per year, depending on, I think there was 8 in our year. But it's really supportive, both of your colleagues, and you're exposed to a wide array of researchers. So it's not just, for me, I was the first OT. Most of my colleagues worked in health economics, pharmacy, health technology, wide array of, so you get amazing training across health services. But OTs are brilliant at research, because research is all about analysing data. And that's what we do every day of the week. We analyse data. We look at the real ordinary everyday stuff, and we can turn that into useful information. We can synthesize it and go, okay, this is what it means. So we're natural researchers, but we often don't think of ourselves or have the confidence in that. I'd encourage any OT to do a PhD. Find a topic that you're interested in, you're passionate about. Get a good network around you. I mean, it's amazing if you can get funding, and go for it, because it's an incredible opportunity. Yes, it's tough. Like, it is tough. There's times where you're like, what am I doing? I don't think I know anything. But you know, everybody has those highs and lows, and that's where your colleagues and your friends and your family go, keep going, and you get there and you come out the other side, and you just can't go back because your thinking has changed so much.
Huge congratulations on that, Áine.
Thank you, Aidan.
Áine, thank you so much for sharing your expertise and your knowledge in this area. As I said, I think you're one of the foremost experts, and it's really interesting for me to know that Ireland is at the forefront in data collection, because we don't think of ourselves as a small nation as being at the forefront of very much. So it's really good to know that. Thank you for sharing with us today.
It's been such a pleasure. Thank you for inviting me. Really appreciate it.
That's all for today's episode on the Irish Occupational Therapy podcast. We hope you enjoyed our discussion and found it informative and engaging. If you've any questions or comments, we would love to hear from you. You can email us at irishotpodcast@gmail.com or connect on Instagram or Facebook.
And remember to subscribe to our podcast so that you never miss an episode. If you found this episode helpful, please leave us a review on your preferred podcast platform. Your feedback is important and helps us to improve the show, so please do leave it. Thank you for listening to the Irish Occupational Therapy podcast, hosted by myself, Jen Trachek.
And myself, Aidan Rutledge.
We look forward to sharing more insights and knowledge with you in future episodes. Until then, take care.